who wants or needs mental health care will be able to easily access quality, affordable care in their community. MHAP, we have a listing here of our objectives, and you'll receive these slides after our presentation today. Again, our vision and how we're working together. MHAP does this through a variety of work groups and through learning sessions and through our summits. We're guided by the work of a core group, and I serve on that core group, and we're really coordinated and managed, and all things happen through our partners at NAMI Wisconsin, who graciously support and provide the foundation for all of the work that we are trying to do together as partners. As I said, we work in summits, and then in these learning sessions, which the learning sessions really, our hope is to provide a level set on some key facts regarding mental health needs in our state. So we've hosted a few of these learning sessions on a variety of topics, from sort of 101 on Medicaid in our state to understanding crisis services. And again, so today we really welcome you for this opportunity to do some level setting for us all around children's behavioral health in Wisconsin, and how we're caring for our kids and how we're thinking about what they need, and understanding sort of that the scope of the need and what we know about that, how children access services, and how we support that through both our public sector programs in particular, and on the public and private side. Our presentation today, I'll be facilitating, and we'll walk through, and then we'll be really pleased to welcome some of our panelists today. So as we shared with you all, we're really excited to hear from Linda Hall with the Office of Children's Mental Health, and then Ann Kelly Kumichael from the DHS and the Children's System of Care Coordinator will be sharing, along with two of her co-chairs from the Children Come First. For those of you that aren't familiar with Children Come First, great introduction to all of the wonderful work that they are doing on behalf of children in our state. And Phil and Kia will be joining in that presentation and providing that background information. We'll then move into small group discussion, and we'll have some time in breakouts to really process on things that we heard, things that you may have heard for the first time, things that you might want to learn more about, things that you think are gaps in what was shared today, that you think are really critical pieces that should be part of the mix when we're talking about level setting around children's behavioral health in Wisconsin. And then we'll come back out into large group and do some sharing out from our breakouts, and then we'll wrap it up for your Friday afternoon. So that's our plan. That's our roadmap for the day today. I thought I would start us off with a kind of a quick hit on some basic facts regarding children's access to behavioral health services. One of the frames that we provide, because we really see it as critical in our work here at MHAP, is to think about where Medicaid fits as a factor for all of our behavioral health services. We know that Medicaid covers, in fact, 1 in 3 children in Wisconsin. And looking at the enrollment numbers just before this, that's nearly 500,000 children in the state that are enrolled in a Medicaid program, a Badger Care program of some kind. And children covered by Medicaid, we know, are more likely to access mental health services. So when they're enrolled in Medicaid, they have better access. In fact, 75 to 80% of our children receiving mental health services really receive those services in school. And we know that the majority of those children that are receiving their services in school are covered by Medicaid. So that, I think, this factor from that Wisconsin Mental Health Needs Assessment and the data is somewhat dated. I think it's pretty stark that the public sector serves nearly twice as many youth as the private sector. And that really contrasts with our adult side services, where you would see that it's more even between private and public access for mental health services on our adult side. So really, we know that our public side services are a huge factor for our children when we think about where and how they're accessing mental health services. So with that, I'm going to kick it over to Linda Hall to get us rolling and moving through our presentations this afternoon.
Thank you, Kathy. And thanks to the work group for inviting me to talk about children's mental health. There's certainly a lot to talk about these days, and the youth mental health crisis is real in Wisconsin as well as across the nation. So I have a slide that's a little bit of an agenda where I want to take this presentation. So I'll just touch on our vision and role for the Office of Children's Mental Health. Of course, I'm going to talk about the data, the most recent data and the 10-year trends. Importantly, talk about what works, and then talk about some top policy priorities. So next slide. So here you see what our vision is, that children are all able to see. I don't have it memorized. As much as I try, it doesn't, I don't have it memorized. I'd never make it as an actress. Wisconsin's children are safe, nurtured, and supported to achieve their optimal mental health and well-being. And importantly, our vision includes that systems are family friendly, easy to navigate, equitable, and inclusive of all people. I think that is a really strong statement and it is a really guiding fact for us. So on the right of this slide, you see the two statutory requirements we have. One is to improve integration across state departments, and then the other is to track data around children's mental health. So on the next slide, though, you'll see that how we focus our work. We really go beyond what's in statutes and say that what we really want to do is focus on systems change. And the way we go about systems change is through collecting and reporting data on children's mental health, then really amplifying youth and family voice, especially so that we have youth telling us, what's the most important thing to do, and that we take a collective impact approach. We are trying always to assemble people from lots of different organizations and different viewpoints to help inform us on what we should be doing. So with the next slide, what I want to do is move into our annual report. I know that many of you were either participated in our annual report briefing on January 10th, either in the room or online. So I won't go into a lot of detail. I'll really just kind of skim over the important points. But the entire report and a video of the entire event is available online. And you can get it by going to our homepage, children.wi.gov, and there you'll be directed to a page that's just on the annual report, and there's a link. You'll actually see the video show up there. The reason to watch the video is to see fantastic presentations by the panelists that were there, including Ms. Kia Chensrud, and the two students that we had speak told very powerful stories about how they are addressing their own mental health and working their way through it. So with that, I'll just give a little bit of information about the report, because I know many of you already are familiar with our report. But you'll see these are the ways that we categorize the 41 data points that we watch. And we group them in these different categories, pretty much following the county health rankings categories. And then in the next slide, you'll see that when we talk about comparing data, it's primarily 5-year chunks that we're comparing. So the time between the baseline and the current data are approximately 5 years. The data sources that we use are primarily the Youth Risk Behavior Survey and the National Child Health Survey. And we use those because they are national surveys that are consistently reported out, and we can then see how Wisconsin compares to the rest of the nation. So with that, I want to highlight some of the trends that we see. As I'm sure you have all heard, that there are many more kids who are feeling anxious every day. There's been a 29% increase over this 10-year period that we were looking at. And in terms of depression, there has been a 42% increase. So very, very concerning. And the rate of depression for boys has really been going up at a faster rate lately. So the next slide addresses self-harm. As many of you know, self-harm is a factor that is more often seen with girls. It can be cutting, it could be burning or hurting oneself in some way without wanting to die. And we're seeing a 21% increase in that. There also has been an increase in the number of kids who are thinking about suicide. So overall, the rate is 41%. But if we take that apart a little bit, we find out that nearly 1 in 4 girls reported that they had seriously considered suicide. And the rate for LGBTQ kids was even higher, at 40%. So more disturbing facts. But there are lots of things that help. And we also always want to focus on that. So coping skills and universal screening are things that we are looking at a lot and collecting from young people what their coping skills are. We have a couple of infographics on our website that were built by collecting the information that young people gave us at our summit last year on what they do to cope and how they would like adults to respond to them when they're having issues. So there are, yeah, I don't know. Sorry. I'm getting a little lost here in between the slides. So let's just go on to the next slide. So we also see that there are decreasing protections in many ways. More kids are hungry, more are getting insufficient sleep, and they're on their screens late at night. And there are fewer kids engaged in extracurricular activities. And without these protective factors that help the brain and the build its connections that it needs to be healthy, it's very difficult for kids to maintain a positive mental health attitude. So these decreasing protections are really serious. But moving on, we'll look at them in a little bit more detail. So with hunger, we see that there are 30% among the teens who were hungry, 30% were seriously considering suicide. So hunger is really an issue. Black kids are nearly 5 times as likely to be hungry as white children. So the overall statistics are concerning, but when we tear them apart a little bit more, we find some even more disturbing trends. Plenty of opportunities for us to work ahead. Going on to the next slide, we'll see a little bit more on the detail on the hunger. And you see that in 2021, the hunger gap between Black and white kids was completely eliminated. And this is really because of the child tax credit that was passed during the COVID pandemic. And now that that money is no longer available, that child tax credit has ended, we're seeing more kids drop into poverty. So now, though, multiracial kids are 6 times as likely to be hungry. Then here we have, and more of the decreasing protection is the sufficient sleep. There are just fewer and fewer kids getting sufficient sleep, and 1 in 5 students reports getting 5 or fewer hours of sleep a night. I tried that when I was in college. It didn't work. I did it for a couple of weeks, and I was like, no, this isn't going to work. You just can't function with that amount of sleep. Your brain doesn't get the rest it needs to really go on. So this is a real problem, and part of the reason that they're not sleeping as much because they're on their screens late at night. And I'll just leave it at that. 53% of teens are on their screens after midnight. So clearly not able to get a full night's sleep if that's the case. Then with extracurriculars, again, this is important because when kids are engaged in extracurriculars, they are meeting other kids, they're learning to make friendships, they're feeling like they belong. And kids who are engaged in extracurriculars, whether it's sports or music or dance, are really always doing better than kids who are not. So another disappointing factor that this is on the decrease. So what helps? Lots of things help. One of the top things that we think about are family media plans. And the American Association of Pediatrics has a really great website for families to use to make plans, a family media plan that works for your family and can be adjusted as your kids grow. So that's really important. And then social connectedness. We've been talking about social connectedness for a couple of years now, but it continues to show that when kids feel connected, when they feel like they belong, they do better. So some of the protective relationships that are important, as you see here, are school bullying. Sorry, I jumped. That's like merging two words together. School belonging. We want to see less bullying and trusted adults, all things that we can focus on at school. So belonging over this 10-year period has decreased by 37%. And that's just something that is really critical because when kids feel like they belong, they show up at school, they do better academically, and they feel better. So, and the kids actually need to feel like they belong, not only at school, but in their families and in their communities. So plenty of opportunities for all of us to work on the belonging issue. And this is something we're going to be focusing on even more in 2025. So with bullying, we know, I think that that bullying has increased. 1 in 4 students talk about having been bullied. And part of the increase is from cyberbullying, the electronic bullying that goes on. And kids start disputes during the day and those carry on into the evening. So kids don't always get away from these negative factors. And more than 54% of girls feel that bullying is a real problem at their school. Trusted adults is another important aspect. And not a lot of kids have a trusted adult, but many Black students do not. And when they are asked, they say that they really would, if they have had an adult in the past, they know from experience, but they also say that if they don't have an adult, that they wish that they did because they are sure that that would help them through some emotional problems and challenges that they face. So just another factor that, can make a difference for kids. And the next slide. These are, for some of these things that we've just been talking about, what's really important is school culture. What are we doing to help all kids feel like they belong? The confidential tip lines, like the Office of School Safety runs and others, can be very helpful. And they allow the kids, to feel like there's someone listening to them. And those tip lines are important because they can confidentially report something that's of concern. And the staff at the Office of School Safety can often help. They can talk kids through it. So now I just want to, this section is a bit of a review of what we talked about, but with a few more comments in it. So in the areas of improvement, youth and young adult employment is up. Kids are making and keeping friends with less difficulty than before. That was a factor we were watching before, and now we're actually seeing that trend kind of turn around and get better. Students are drinking, smoking, and vaping less, and the teen birth rate continued to decline. So other factors of improvement are that more mothers have higher education degrees, fewer kids are in foster care, and child poverty has declined. Although, as I mentioned before, that poverty rate is climbing back up because of the termination of the child tax credit. So we also have seen the number of psychiatrists in Wisconsin has increased, and the number of school mental health professionals has increased, although the numbers of individuals in that category are still not at the recommended rate. And, for us to really have a more improvement in this area would require more support and payment for these services at school. So some areas of concern are that preschool enrollment has declined. And for many kids, that's an important step to jumping off well as they start in kindergarten. Their kids are having too much screen time. Parents are relying too much on screens to when kids are, dysregulated or, rather than getting up and playing, getting them outside to play, screens are being used for kids to entertain them. Then, as we talked about, the sleep has declined for teens, and the kids who are participating in activities has also declined. So here on the next slide, we see again that teen anxiety and depression and suicidality are continuing to go up. And we know that about half of kids who have a mental health concern don't get treatment. And those who do get treatment are more likely to get it at school. I think Kathy mentioned that. And the number of young adults with a mental illness has increased, which is also concerning because we know that they have difficulty accessing treatment too. On the next slide, we see that another issue is that the majority of doctors don't ask parents about learning, development, or behavioral problems for their kids who are 0 to 5. And we hear from a lot of parents that they would like to have more of a conversation with their pediatrician. I know that our Wisconsin chapter of AAP is working on this, and we are certainly getting out information and encouraging doctors to add this to their list of things that they ask their families about. So I think we already talked about teens and trusted adults at school. That number has declined. And as we said before, teens who feel like they belong at their school has declined. So with that, I wanted to mention a few top policy priorities from our perspective. One is school mental health funding that is per pupil with a sustainable ongoing funds. The introduction of psychiatric residential treatment facilities into our children's mental health continuum would be very useful, and there has been plenty of talk about that this year in the legislature, and we hope to see that move forward. The Office of School Safety needs sustainable and ongoing funding. Their operation of the Speak Up, Speak Out tip line and the work that they're doing to prevent threats at school and to help school administrators work through problems when there has been a trauma at a school. They're doing some great work, and they have really transformed this office from one that was more focused on, well, I would say focused on bulletproof glass than they were on mental health. And there are many more people there now who are really focused on that and are available to talk to kids. Kathy mentioned earlier that the kids who are on Medicaid actually have more access to treatment right now than kids with commercial insurance. And so one of those reasons is because some of the insurance companies are not paying for therapists at school or not paying for qualified treatment trainees who are among some of the most important trained mental health professionals available to work in schools. Then, of course, I want to mention that Governor Evers, in his State of the State message, declared 2025 the year of the kid. He is promising $300 million for school mental health in his budget that will come out next month. He's also proposing free breakfast and lunch for all kids. And so, as we noted earlier, hunger is a real issue. We also know that kids who are food insecure are more likely to be bullied at school. So it's sort of a double reason that we should do that. And he also, I don't have it on the slide here, but he's also has put forward a number of policy ideas, policy options to reduce violence, to reduce gun violence. Our kids in this nation are the number one problem for them. The number one way in which kids die is by firearms. And that's true for the United States, but no other large developed nation. So it's a real problem. The governor has proposed some safe storage safe storage ideas and other ways that we can, through red flag laws and other kinds of background checks and that really reduce the violence. And this is really important because when we look at what kids care about, what they say and contributes to their anxiety and depression, they list 5 things. And, after academic pressures comes gun violence and climate change, political divisiveness, and also then the other factor is, I always stumble on the 5th one. Well, anyway, 4 is enough. So that's a really quick overview. If I had the opportunity to ask a question, I would be interested to know if there's time, maybe not now, maybe it can be during the discussion time. I'd be interested in hearing a little bit about from folks here on what are the of all these data around youth mental health, which are the ones that strike you as the most important? And when you talk to colleagues and people in your neighborhood, what do they, when you bring up youth mental health, what do you think makes a difference to them? Because I think that all is important for us to figure out how we have conversations about this and advocate for change.
Yeah, I love that, Linda. And thank you so much for this, for reviewing this data. I really feel like the way that you all compile the data is super impactful, and I appreciate and continue to be grateful for the array of factors that are being taken into consideration when we think about children's well-being and all of the elements that flow into that, and breaking down the populations as well, I think is really important. That's into some of the subpopulations that are impacted. I think we're certainly going to capture those questions when we're in breakout discussion, as well as people are reflecting on kind of what resonates and then what's missing, and what's most impactful. I think is a great addition to those questions when we go into breakout. I'm going to transition us over to our friends from Children Come First, and I'm going to invite Anne and Phil and Kia to step to the floor with their slides. And Anne, your slides are coming up. Looks good.
Wonderful. Okay. I hope I'm coming through all right. I've sort of been assigned to kick us off. Phil Robinson here with White Pine Consulting and co-chair with Kia Jensrud of our Children Come First Advisory Committee, which we would not be successful in the least without the support of Anne Kelly Q-Michael, who is our DHS support in keeping us organized and on track. And I will provide us a little bit of a starter just to introduce who we are and where we fit in the overall picture of what's happening with children's behavioral health. We will, effectively what I'd like to do is kind of describe our vision, which is, children and families are valued, understood, and supported in their communities. And our mission, which is, to really support, find ways to help children, young adults, and families receive the right help at the right time, the right amount, by connecting and coordinating the work of all system partners. Okay. Which is why it's perfect that we're here today, because of the forum that's afforded us by the MHAP group and Office of Children's Mental Health. This is our chance to really support those system partners and kind of weaving this together and that you all can start to hear about each of us and understand where we may fit and where you may be able to connect with us and continue the good work. And I like Linda's posing a question, and I'll do that as well, just because I'd like you to think about where you have voice, access, and ownership within the sectors that you're serving. And where do you feel like you can bring those questions and concerns forward? Obviously, MHAP is doing a phenomenal job with that. Office of Children's Mental Health with Collective Impact is doing an excellent job with that as well. And we want to also be our Children Come First Advisory Committee. We want that to be something that you're aware of and you know how to reach us. Okay. So what you're going to hear from us is a little bit of a snapshot of the Children Come First Advisory Committee that I'll provide, and we'll walk us through a little bit of what happened when we developed this summit, the Children's System of Care Summit, and then what comes out of that. Kia and I will describe for you the priorities that were established and the work developing a strategic plan from there, which is now going to provide guidance for the next 6 years. So in that, and we'll also provide some links to websites so that whatever we're talking about here, this is just a snapshot. It's a quick take, but she'll provide the links so that you can go to the websites and see what's there. You know, observe the program, look at the components, look at the membership, you know, start to kind of carry that forward. Thank you, Anne. So feel free to pop those up as we're talking, as it makes sense for you. And I think if we could go to the next slide, here we are. Great, thank you. Thinking about our Children Come First Advisory Committee, it was established back in the 80s. It's ensconced in Statute 4656. Many of you who may be familiar with coordinated services teams may have, you know, read the material that kind of provides our charge. Okay, this is something that is meant to be very much like the coordinating committee at the community level, but we're operating at a state level, bringing state partnerships together in order to be effective at, you know, and mirror the two efforts. Let's see, our charge is effectively to support and cultivate a comprehensive system of coordinated care for children involved in 2 or more systems of care. Okay, so when you think about it, these are children with complex needs. They're touching many different parts of the community. They're often misunderstood, and they don't access services as directly as we would hope. So that's our charge in it. And if it sounds like coordinated services to you and or comprehensive community services, that would make sense, because those are 2 programs that we spend a lot of time talking about, and want to make sure that we're streamlining and understanding and supporting the implementation of those models, as well as other projects that are working around the state. Our role is, you know, it's to guide and transform the system of care. And our function is effectively advisory, but it doesn't mean we're sort of waiting to just weigh in on things. This is a group of very forward-thinking, action-oriented members based on the breadth and depth of expertise that they bring to the table. And we've been really fortunate in the past few years to be able to do some really good work. That's what we want to share with you today. So the diagram that you see on the slide here is just a representation of the different types of interests that we have at the table. We have about 36 voting members right now. You may be familiar with Emily Coddington, who has been involved with MHAP, and she's been a member of our committee. We have a number of folks who have been on these workshops as well, and we really want to be cross-pollinating good ideas and bringing the information back and forth. Our membership is, as you can see, we're including all different sectors, you know, from advocates, we're, you know, addressing, you know, the healthcare providers, courts, child welfare, tribal nations, counties, coordinating committees at the local level, DHS folks. You know, we're really looking for that representation across all sectors so that we can really see what's happening when children with, you know, complex needs are touching the communities in which they live. How does that impact the systems, and how can we be informed about that? So we're seeking a balanced perspective at all times. If you were to go to the link for our page, you'll see the membership of the committee. And if you see folks on that list that you know, that might, you know, that you be familiar with locally, just consider them a liaison to our committee. And as you have questions and ideas that you want to share, they, you know, bring that to them and they can bring it forward. It's also possible to reach out to myself or Kia or Ann at any time with them, ideas or questions that you might have that we could be considering. When we think about our membership, we're really trying to leverage the collective resources to effectively sustain positive change. So this is really what we're about. And if you could go to the next slide, I want to just mention kind of where we sit in the overall systems. You'll see us down at the bottom of the page here. Children Come First Advisory with our membership is a mirror of what's happening at the coordinating committee at the local level. But we're partnered with the state agencies, Wisconsin agencies, and also the tribal nations, counties, and other partnerships like MHAP. Okay, this is where we really need to be working together. Combined efforts around improving the opportunities for children and families from the state. So we meet quarterly, just so you know, which doesn't sound very often, and it's not. But we also have work groups. We have a system of care work group in partnership with DHS, where we have a group of subject matter experts on any particular topic that we bring together, and they go into the weeds and do digesting of whatever the issue is and think it through, and then make recommendations that are brought back to the committee for rounding and appreciating kind of what are we missing, what do we need to know, how do we put this into place. And then from there, the committee can, vote and take an official position on any particular initiative. So we're a combination between sort of an advisory committee at large that's weighing in, but also work groups that are generating product. Let's see the next slide, if we could. This is just a time frame for you, so you can kind of see where we've been. You can see at the lower end of the 1980s, that was where the committee was formed. 4656 was established. We're really focused at the lower end of the 2000 to present, because in that zone is where we're going to start to see some of the really significant change that's been happening recently. We as a committee will establish priorities that we're going to work on from year to year. As of late, it was to really promote data-driven decision making. It was to promote also a better engagement and leveraging of Medicaid services, and also develop that children's system of care. So what had been started with the Georgetown Academy back in 2015, we picked that up and did several years of planning before the summit, which Anne's going to tell you about, was put into place. And the planning that went into that was just very well informed. The information that was gathered to make that useful was very purposeful, and we're trying to make good on every part of that initiative. But it gives you a sense of what's been evolving over the years, okay? And the tangible products, if you're wondering, well, what the heck does this committee come up with? Well, we've been weighing in on things like the system of care self-assessment that DHS has been promoting to look at the broader systems. Also, supervisory and care coordinator competencies for wraparound programs. We felt like that's an important part, where you're saying people who are supposed to be coordinating the care and also their supervisors, what are the core components that they need to be focused on and trained around. Also helping to establish the vision, mission, and 4 core values of our system of care. And then, of course, planning and implementing the summit. And then from there, the priority areas that came from the summit, and then the strategic plan that followed. So I hope that all makes sense. Let's see. I think from here, Anne, I think our agreement was you would pick it up from here and take it to the system of care. Does that sound fair?
That sounds fair. So I get to share a little bit about the philosophy, but it's also important to know that the Wisconsin Children's System of Care is built on 3 components. So the philosophy really is the guide to the delivery of services to children and families. The infrastructure fulfills the essential functions of the system of care. And then there's also the 3rd component, which is the comprehensive array of services and supports that meet the needs of children and families in Wisconsin. So the philosophy, we are guided by 4 core values: family and young adult, voice, and choice. So very similar to OCMH, the Office of Children Mental Health's pillar of family voice. We believe it's really important that families are at the table and able to decide the support that's provided to their family at the child and family team level, but also at the state level. So they're involved in the system changes and policy-making decisions. Community base is about, to all extent possible, we're providing services to children and families in their communities, whether that be in their homes safely, in schools, in primary care settings. So community-based is about those communities providing that support to families in their communities. Cultural and linguistic responsiveness really is making sure that we have equitable services and supports that support the diverse families that we serve, so that they have quality care. and then unconditional, which is that we don't give up, and we do that really well in Wisconsin. It's really working toward meeting the needs of children and families in a way that is focused on their care, even in challenges or something. So Phil introduced you a little bit to the summit, and he's right. So it was a part of the Georgetown plan, to really create a strategic plan. So Children Come First said, we really need to have a plan to move our system forward. And 2 years in the making, the summit came together in April of 2023. Is that correct? Yes. Seems like forever ago. But 2 years prior to that, we created a framework, which was really to create an opportunity for individuals to come together again, really modeling the Children Come First Advisory Committee. So making sure that those individuals were at the summit to create an opportunity to inspire, to inform, and to implement. So that creating of the plan. So part of that information gathering was collecting survey data. We had a large number of surveys that were returned. We had sharing circles that were facilitated with young adults and families. And there was actually a Tribal Nation consultant that we brought on board to do sharing circles with all of the tribal nations to make sure that their voices were heard and information was gathered. We also used a technology called Thought Exchange through Change Matrix. And that was an opportunity for us to go out to directors' meetings across the state and other meetings across the state to really gather information that way through that technology, which was pretty cool. And so the system of care work group that Phil mentioned actually took that information and they titrated it, they evaluated it. So prior to going into the summit, we had a lot of data to share, and I will make sure that all that data is in the chat. It's actually composed into one document, but you'll have access to it. And if you go to the Children's System of Care website, there's a QR code at the end of the presentation. All of the summit actually that was recorded actually is there. So you can actually watch the summit, and then any information that was shared is also captured there as well. So again, we collected the surveys, we completed them, and then the sharing circles that we used as well to make sure that we really had all that data to present at the summit, that 2-day opportunity. At the summit, we had 135 participants out of 211 invitations, and below is not it's not inclusive of all the state agencies, but participants included the individuals here, along with state agencies from DHS, Department of Health Services, Department of Children and Families, the Department of Corrections, the Office of Children Mental Health, the Department of Justice, and the Department of Public Instruction, and universities of Wisconsin. And now I think I'm going to hand it back over to Phil.
Okay. So when we think about what came out of the summit, these 5 areas are the priorities. The objective is kind of the definition, which you're going to hear in a second. And then there's some key results that we came to through our work groups. What would we see if these priorities and objectives were being implemented across the state? And obviously, you can see on the slide the different sectors. They align very nicely with MHAP's also priority areas and other groups as well, where we realize that these are the topics that are non-negotiables. Okay, these are the areas that we need to be focused on if we're going to move the system forward and sustain progressive change. When we get to, when we get to looking at the strategic plan, there's timeframes for a lot of our key results and when we would be taking on the various objectives and addressing them based on what's emerging. One of the important parts for us was to recognize that this focus for our initiative was to reduce the duplication of efforts. Okay. One of the things we realized is that when we're talking to people across the state, different sectors, different interests, there's a lot of duplication, or the right hand doesn't know what the left hand's doing, and it's wasted effort. So we really want to be aligning. We want to be communicating. We want to be encouraging that access and consistency as much as possible. So again, why it's really great that we're here today, sharing what our work is. When we get into the strategic plan, we understand that as again, part of our framework for addressing what's coming. And when we put that strategic plan together, we looked at what's important, then we looked at the timeframes, and we said, based on what's happening in local communities, based on what's happening around the state, what's happening at a federal level, what are the areas that we need to be addressing first, in the next year, in the next 2 years, and up to 6 years, okay? And how would they space out? In that, there are emerging opportunities, such as the work that's going on by MHAP, okay? There's a really nice overlap there. And there's also the new priorities that are coming our way that'll kind of catalyze our strategic plan. So there's a legislative study committee on civil commitments. There's also the Children with Complex Needs initiative at a very high level that's being implemented or being considered for implementation around the state. This is work that we're well positioned to meet those new opportunities because of the framework and philosophy that we went into the summit with, our focus on infrastructure, and our commitment to expanding and improving the system, the access to services. So with that, no matter what we did, it always had to speak to each level: philosophy and framework, infrastructure, and service survey. So with that, I think I'll pause and let Kia pick up a little bit of a overview on the priority areas.
Thank you, Phil. I'll try to breeze through. I know we don't have a lot of time, but I do want to say that I'm really thrilled to be here and to be collaborating with all of these organizations. I see a lot of familiar names, and so it's really great to be here representing primary care, but also a lot of different efforts over the years. I've been on this committee since 2014, and it's just really exciting to be at the state where we're at with the strategic plan. So diving into the strategic plan just a little bit, I just want to underscore that all of these activities are going to be driven by the data that we collected, before, during, and after the summit. And as with most strategic plans, we do have timelines and goals that are sort of short, medium, and longer terms. So I thought for each of these areas, I would just give a few bullets on things that we're looking at for each of them. So first, for governance funding and state and local partnerships, two of the things that have come up that we feel we can bite into right away is to look at, with the information that we have right now, to look at making recommendations on and keeping it reined in, right? Because we can very easily, with all the things we're looking at, start to spin out to a lot of different areas, but really reining ourselves into a small amount of a number of funding and policy and systems changes to improve the efficiency of service deliveries, as we've identified where some of those improvements need to be made. And when you remember the slide Phil had with the different areas of the committee and the different groups that are represented, we still know that there are others that aren't represented in the group. And so who are those folks, and who can we bring in to really enrich the committee and get that cross-section even more representative of the people in the systems that we're trying to represent? And then in terms of the second goal there, the second objective of crisis support, specialized residential services and supports and respite, we are looking at, and I know many of you are on top of this or working on this, looking to support the development of a psychiatric residential treatment facility in our state, looking at any type of funding initiatives that come up within specific legislation that affects all of these areas that we're looking at. And then also, we know that there are a lot of different program and payment models that, whether it's in Wisconsin that we've already looked at, that might be similar to other states or other areas that are either regional that might scale up to state, that definitely would include peer support or other helping hands, as some people like to refer to it. So what might those models look like that we haven't really mined yet? Next slide, Anne, please. Parent and youth peer support initiatives. I think for those of you who were at the summit, for those of you who are on our committee, I don't think there's really any stronger stronger resounding words that come up over and over again than peer support, peer specialists. And I think one of the things that also came up is there may or may not be clarity on what we mean when we use those terms. And so we really want to have an understanding and a better understanding about those terms and also then how that relates to outcomes for children and families. And then also looking at recommended approaches that really ensure that these supports and services that we talk about improving them, which of course that's always the goal, but are they based on family and youth underlying needs and priorities? As Anne mentioned, are they really looking at the child and family team at the center? And that any subsequent changes that might come up in these plans, including discharge, are mutually agreed upon, that really we're putting the family and child at the center of those approaches. And so we really want to get to the heart of parent and youth peer support. Public health approach. And I want to stop here just for a second and mention that each of these priority areas had a legion of worker bees meeting on the regular to really pull these apart and look at all of these. And I just want to say thank you. Some of you are on this Zoom right now. It was really dedicated force of people who care so much, and it took a lot of extra time and effort. And so when you hear me reading these off, sort of, it's not glibly, it's based on a lot of work that went through this. So I just want to stop to pay honor to that. So public health approach for health and mental health integration. What we know that we can do for our committee is that a lot of people don't know about the work that we're doing. And so as a first step, we want to draft a comprehensive communications plan and communications sort of outreach that kind of outlines, hey, here's what we've already done. Here's what we're looking to do. And again, sort of translating and digesting the strategic plan to partners, to other groups that we can work with that make sure that all of the work that we're doing is transparent, that we have alignment, and that we get more engagement with folks. We don't want to be the best kept secret. We want all of this work to really be knitted into other initiatives that are already going on throughout the state. And finally, one of the hardest topics, of course, is workforce development. And so identified by this subcommittee was the governor's task force on healthcare workforce. And so working with them, again, not to silo and spin into our own thing, but to really say, hey, there's already this work going on. So they're charged with developing strategies to effectively address the shortage of healthcare workers across the state. So how do we knit into that and really make the most of their work already? So that's just sort of a high level look. Anne is going to put up the QR code for going to the full strategic plan. You see everything, short term, medium term, long term, it's all there. So I encourage you to do that. And as Phil mentioned, please let any of us know if you have questions, if you're interested in contributing, interested in the committee, please.
Yeah, I will say my information. One of my favorite parts of my role is to serve Kian and Phil in the capacity of the staff to the Children Come First Advisory Committee. So if you're interested in learning anything or meeting with Kian and Phil or have questions for them or membership, you can email me most definitely, and I will do my darndest to get a meeting scheduled for you with them to talk it through.
You guys covered a lot in a short period of time. Very efficiently. Thank you for that. And there were some questions in the chat, and I wanted to just and kind of notate those, and wondering if we could maybe take them very briefly before we go into our breakout sessions. The first is about evidence-based practice and where that fits into any of your strategic planning discussions. If we can address that briefly, or you can tell me that's not a brief question. It's and very well might not be.
Yeah, it's a very good question, and it comes from Kathy Colley, which is no surprise. Thank you, Kathy.
Right.
And yes, evidence-based practices was part of the discussion all the way through, and it's languaged in our strategic plan as well. And so the idea is wherever we can, we want to be promoting them. And of course, there's so many different versions of that. It's a hard one to answer in just a quick soundbite. But please look at the strategic plan, and you can see where we are on that. We absolutely we must incorporate strategic or evidence-based models and see what's effective and champion them from there. So I'm hoping I'm doing it due justice. I know I'm not, but that's probably the best way to answer it right now. Okay, that yes, wherever possible.
Yeah. Yes, and then I think the other one is just about peer support and talking about teens becoming certified as peer specialists. Anybody can kind of talk about sort of where that sits within your conversations again, and this may just be another space, but
again, it's another. I'll just say, and I'll let Kia and Anna comment on this as well. It's very much part of our interest in where it gets specced out specifically. It's kind of, I couldn't speak to that in itself, but I know we have youth voice on our committee. That's an important part of our model. We really want to be championing that. So thank you. Lelania, appreciate the question, and yes, it is as important to have all the voices of the lived experience folding into what we're trying to do, and they obviously have a good part to play, and it's just a matter of where that's going to land. So I think it's still we'll see the specifics manifest over time. So and Kia or Ann, if you want to weigh in on that, please do.
I think Kia kind of spoke to it a little bit about learning more about what that definition is. And so part of Children Come First Advisory Committee, you guys have requested that Kenya from the Department of Health Services, Kenya Bright, along with Lynn Made Big Boy, come and share with us about parent peer supports and peer support. So that'll give us a better understanding. I'm not sure where we're at as far as youth certified peer supports, but they'd be the individuals that could share with us kind of the direction. So hopefully in April, in the April meeting, I think we might be having that come up. That's up to you guys, but I know you've been talking about it.
Well, I know we were closer to it on the next agenda, but I think we have to move it because of a recent initiative. So, but it's in there. It's absolutely up front this year. So it'll be part of our learning.
Yeah, the Children Come First Advisory Committee is a public meeting, so it's public noticed. So anybody can come and observe the meeting of the members. So presentations like that are often get the most people kind of viewing the meeting. So yeah.
I love that you shared that, Anne. Thank you so much for remembering to share that. Linda, you had your hand up.
Yeah, I just want to say that our office is obviously very committed to parent peer support. We are always, working with people who express an interest in doing that to help them get on a path to becoming certified, if that's what works for them, or to connect them with an organization that's ready to support them as a peer support person. We've also looked numerous times at teens peer supports, and that's something that we're still studying because there are just different issues related to minors doing this. So that's why we're really focusing right now on supporting youth who are leaders on mental health in their schools. So the youth who are leading the peer-to-peer or mental health awareness programs at their schools, that we are giving them support and encouraging them. And, we have over 300 of them in schools in Wisconsin already, with those young people also starting ones in schools nearby. So trying to build that in leadership. And I see there was another question about growing the mental health workforce. We think about that as we try to convene young people to think about mental health and their role in supporting their peers. We're hoping that this will open up to them ideas that they might want to go into this as a profession.
Yeah, thank you for that, Linda. I think that's a great response to that for the moment. And I think it's a well-placed question as we roll into our breakout sessions. I posed our questions in there, and what I would say is to also put in your brains the kind of the questions from Linda and Phil around where is I think Phil asked us where are you seeing voice, access, and ownership for you, and from where you stand, how are you experiencing that within what our children are experiencing with the system of care? And then Linda had also posed, from the data that she shared, what's missing, what's really resonating with you, if we can reflect on that. So these questions, we're going to go into small breakout groups now. We have facilitators in each of our sessions who have the questions. So no worries as we walk in that they'll be able to help walk us through what questions we have available to us. We don't expect we're going to get to all of them, but really just an opportunity for you to interact with some other people who have touch and care for these issues across Wisconsin, and kind of share forward, do a little joint learning, and then come back out into big groups. So I'm going to have Julia go ahead and put us into breakouts.
And for how long, Kathy?
We're going to go in for 15 minutes. That's what I'm going to say.
Okay, so we'll come back at about 3:48, 3:49. Yeah.
And talk about where we go next. And I hear Julia on the record button. Thank you for that. We're back on. So let's do some sharing out from our groups. We had how many rooms, Julia? Did we end up with 8?
Yes, I believe we had 8.
Okay. Anybody want to raise a hand? Feel free if you want to, as the reporter out, if you want to drop it in the chat, or if you want to share. I will start from our group. Couple of great, like, what else, what more? Focus on early care. Thinking about, so appreciating hearing that data from Linda and thinking about what we're doing with our early care space, but knowing that we have the mental health consultation piece that's happening within early care, really important, and also at risk at the moment. And so thinking about how we're going to sustain funding in that. I think also then the other observation that I'll call out, we had, again, some great observations in our group, but where we're at with really sharing the burden across the private market, and is private commercial insurance stepping up, and how are we holding them to task around parity coverages. So I'll start with those two, and I see Jeannie Fury has her hand up. Let's go.
So I had the best group. I was part of the best group. So I love what we talked about. We talked about as far as what has been your experience in working with or supporting children and families. Wraparound works for kids. It's strength-based, it's self-directed, and it includes kids in their own plan. And as part of that, as we move into next steps and questions that we have is, we want to hear from the kids. And that includes, how do they become peer supports for each other? How do we create a clubhouse model that the kids can be part of the work being done there? And I thought a really, really good question was, how can we create the no wrong door concept for kids as well? So taking some of the things that are working on the adult level, or what we're trying to put in place for the adult level, to make it that way for the kids as well. So I thought that was some important things that as we look forward, and I think that's part of the strategic plan, as discussed, with Children Come First Advisory Committee, is ways in which we can interject the children's voices, the youth voices, at each step of the way.
Mm-hmm. Fantastic. Who's next? Zeta.
Oh, I had the best group. We talked a lot about how it was kind of impressive that all of this planning has been going on for so long and so extensively, and it really is bringing all sectors of the community together, and it's really good to know about it. I didn't really realize what was going on, so I think a lot more public education is needed. We did talk about your experience what helps with children and families. And one point is that non-traditional services are better, like, bring people in for games and food and after school snacks and do in-car therapy. You're just like, where can the person meet? Where does the person want to meet? Meet them where they are, including in schools. We talked about how schools don't some schools don't hire community mental health therapists, and that's kind of that's a mistake, because that's a real resource and it gives the school flexibility. I'm not really sure what the school systems are thinking in those places. We talked about how we need a lot more support for housing. That's a need that really, it's foundational to use a pun, but just trying to get housing support for families. Of course, your mental health is going to suffer if you don't have a place to live, and sometimes you don't have a place to live because your kid's mental health is suffering. And then also, we desperately need more providers, especially for kids dually diagnosed with autism and or eating disorders, or any of those kind of specialties. And no one has openings. And then it's frustrating to see the need, but good to see the collaborative approach. We also spoke very briefly about elders and about how important it is to bring elders together with kids. And elders often go, I don't relate to kids. I have no idea what they're doing with all those little boxes. I have no idea what their culture is, but they have a lot to share. So educating elders to get together with children to be supports would be helpful. And somebody said DBT worked for my kid. I see Rick Emler here. That's music to his ears. And Kathy.
And I can't believe you did all of that in the amount of time that we had. That's amazing. Okay, Rick, you're next.
Well, I'm sorry, ours was the most outstanding, but we'll not argue. Great representation from Sebastian Family Clinic. And in terms of working in the schools and in the community, some of the challenges were discussed about engaging the parents, helping them understand the array of services, including potential value of medications, and that relationship that may be on a community or school-based level. Comment was made that in terms of children's come first, this is a pleasant surprise. This opportunity exposed folks to something that they weren't aware of. I think I'll throw in a perspective. The profound benefit that as a clinician I've seen in working with multidisciplinary teams to provide psychiatric care, as opposed to attempting to provide individual psychiatric care without a team. It's just so dramatically different in terms of effectiveness. So that's what our group covered.
Thank you, Rick. All right, got a couple more groups. Who's next?
I can jump in. We had a good discussion. Of course, our group was the best, and we had a good discussion about the importance of peer support and parent peer support in particular. Hugh was able to share with us the results of 2 studies his agency, Wisconsin Family Ties, was involved in that had really impressive outcomes, such as keeping families together and preventing child abuse and neglect. And the other study also showed that peer support 73% of the time referred to other mental health providers, and those referred, 96% of them engaged. So that was huge. And of course, on the second question, we were all troubled by how difficult it is to get care and the slowness of things to change. And of course, we all share the dream that kids get the care they need in a very timely way.
Awesome. Okay. How many groups do I have left?
I can go super quick for our group. I don't know who else we have left. I haven't kept track of how many we've done, but one thing that we talked about some was that we are all really excited about the idea of PRTFs coming to Wisconsin and not having to send kids out of state and making it easier to access that level of care, while also knowing that we need to focus on preventative care and intervening with those kids
earlier before things escalate to that point. So kids are getting early intervention. We also talked about access issues, having to travel a really long way across the state to get the care that you need for your kids. And I'm blanking on the last point I was going to mention. Oh, workforce issues. One person in our group mentioned that she's worked with families where they resorted to private pay and they're just paying out of pocket for services, and no matter how much they're willing to pay for services, providers aren't always willing to. You can't find someone who's willing to work with kids who have that level of needs, and so that is a big challenge as well.
Thank you, Julia. And I see Molly dropped notes in the chat. And we have 1 minute left. Anyone else have burning something to share coming out of our learning and conversation today? All right. Pausing is one of my biggest challenge spaces ever for silence and virtual calls. Again, so much gratitude for all of you for sticking through today and on a Friday afternoon for this conversation. Such an important conversation. Love all of the expertise that you all brought to the table for us. And that is really what we're hoping to continue to facilitate through the Mental Health Action Partnership. All of this information helps to feed into the work that our work groups are doing and the policy priorities that are emerging out of our collective. And so I do appreciate, again, all of the pieces that were shared in the chat, and what we're gathering in our discussion today, we will be taking and feeding back to our work groups to help us as we continue to formulate and move forward on an agenda. And so thank you all for being part of the conversation today, for helping us do some joint learning. We know that there is and I love that Children Come First, and so much gratitude to our folks from Children Come First and from OCMH for being with us here today to really share. And I think heartening. I hear hopefulness from people around kind of that growth and knowledge of all of the good work, and that's part of what's great about our space and our forums and our time together. For me, I always am again, it's uplifting to know and to see all of the impact that you all are having from where you are touching and caring for our families around the state of Wisconsin. So thank you again for taking a little time away to be with us here today, and for sharing your insights and expertise. And look forward to future forums where we're going to intersect with one another. And have a wonderful weekend.